Hi everyone, welcome to another virtual breathing space video. I'm Bobby McGee, I'm the advanced physiotherapist here at St Anne's Hospice. So today we're going to cover some slightly different topics. We're going to do an overview of the breathing, thinking and functioning model. We're going to also look at the positions of ease. These are some of the positions you can get yourself into to ease your breathlessness. We're going to look at medication, some of the common medications that are used for helping with breathlessness. We'll also touch on some physical activities, some simple things that you can do to help to keep yourself active. We're also going to look at something slightly different, which is lung meridian stroking. So that's an acupressure method, which can again help to relieve your breathlessness. And lastly, we're going to look at the active cycle breathing technique, which is a common technique that physiotherapists use. And again, that will help you to hopefully breathe a little bit more deeply and also help you to remove some secretions from your lungs. So just to have a little bit of a recap about the breathing, thinking and functioning model, we've talked about this in a bit more detail in one of the other videos, so please refer to that video if you need a bit more information. But just as a quick recap, so we try to break down breathlessness. We know it's a really complex topic, so we think of it in these three terms. We've got the breathing side, we've got the thinking side and the functioning side, and all of these elements really correlate to how well we breathe. So again, the breathing side is about how well we breathe. Do we have an efficient breathing pattern? Are we breathing inefficiently? So if we're breathing inefficiently, we might be breathing too fast or too shallow, or we might be breath stacking. That might be in relation to the particular condition that you have. So we want to make sure that we're breathing efficiently, and that means that we've got a normal rate of breathing. So we want to do that because we don't want to increase the work of breathing, so we want to keep a nice relaxed respiratory rate, so breathing rate if we can do, and we want to try and use our breathing muscles appropriately. The thinking side is more about how we physically feel and think about our breathing. So that might be that on a day-to-day basis, we might feel like we're feeling particularly anxious about breathing, or we might have some distress or feelings of panic about our day. It could be that we're thinking about how our day is going, and that can have an impact on how we feel. We might be having a bad day, we might feel that we're a little bit low in mood or a bit depressed on a certain day, and we know that how we think about our breathing will have a direct effect. So the thinking side is really important to be aware of as well. When we start to think about the functioning side, it's really important that we, as therapists, can see how well you're functioning, but it's something for you to think about as well on a day-to-day basis. You know, how are you feeling within your ability to do all the things that you need to do on a day-to-day basis? So simple things, going for a walk, it might be sitting upright in bed, walking to the toilet, eating, drinking, anything that you do, getting dressed, you know, it could be all of the things that you're doing on a day-to-day basis. How does that impact on your breathlessness? And are there any ways to actually help that, the way you do that activity, to reduce the amount of breathlessness that you feel? So again, we'll touch on that today. So now I'm going to talk about positions of ease. So these are some of the positions that you might get yourself into to alleviate your breathlessness. So this might be if you're just feeling really, really tired after a period of activity, or you're just feeling absolutely exhausted and you need a space to take a break. So we've got a couple of positions that we use here, but there are so many different positions that you can use. And again, it's really important just to experiment and play around with what works for you. So a couple of the positions that we use here and advise people to use at the hospice here is one of the positions is leaning forward. And that again allows you to use your breathing accessory muscles more efficiently. And that's what we're doing with all these techniques really. So leaning forward on pillows, or it might be a table, try to use what you've got around you. And again, we can't always plan for when we're breathless, so it's just about being creative at the time. So leaning forward on pillows is a great position to be in to allow your accessory muscles to work. And again, just separating your legs slightly, and that allows your abdominal contents to move down, and that gives your diaphragm a little bit more space to work, and that will again help us to breathe a little bit more efficiently. The image on the left hand side again is slightly different. So if you're able to relax on your side in bed or on your couch, wherever you might be, make sure again that your body's fully supported, so you're nice and relaxed with your arm again up to one side, and that'll again allow your abdominal contents to move away from the diaphragm, and it should help to make your breathing a little bit easier. So as you can see, there are many different types of positions of ease that you can get yourself into, which might help you to alleviate your breathlessness. So the key thing here is for you to try and play around with what works for you. You know, there's no one position that works for everybody. So it's really, really important to find the right position that works to alleviate your particular breathlessness. And that might be even in relation to your particular condition. Some people will find that forward lean position works fantastically for them. Other people find that doesn't work. So again, these are just some examples that you can use. And again, just think about using your environment as well. Ultimately, we're trying to allow our diaphragm to work more efficiently, and where we can use our accessory muscles to help, then we can do that. So again, it might be that you're leaning forward, it might be that you're leaning up against the wall, it might be that you've got hands on your hips, hands over your head. Just again, play around with it, and hopefully you will then find a position that works for you. So the use of walking aids is another really good tool to actually help us to alleviate our breathlessness. Think of it as a portable kind of leaning post, so you've always got something where you can use it to take a break, get yourself into that really comfortable forward leaning position, as we've talked about, that allows us to use our accessory muscles more efficiently, and it allows us to just take a mental break as well. If we need that break, if we're exhausted or tired, we've always got that walking aid to help us. So think about the type of walking aid that you might use. So if you're using a walking stick or a wheel Zimmer frame or a gutter frame, you might find that you're not currently using it as much as you could do. But again, taking that time out to try and pace yourself when you're walking, so having regular breaks as and when you need to, that might just allow you to function more easily and get that little bit further. And you're also managing your breathlessness at the same time. So again, take a little bit of time to think about what you do with your walking aid and to think about how it might be able to help you with your breathlessness. Now we're going to talk about some of the medications that can help you with your breathlessness. Now, it's really important that you try and get a really good understanding and grounding with the non-pharmacological techniques that we've discussed in some of the videos in this video today. Now, we know that medication can have a really important effect, and it can be a really good add-on, and using those as adjunct to your non-pharmacological techniques is going to be a really important thing for you to manage. So we know that there are different types of painkillers that can help relieve breathlessness. Opioids probably has the strongest research base, and they're the most effective pharmacological agent for the relief of breathlessness. That includes oral morphine. That will be a normal release, about 2.5 milligrams. If people are what we call opioid naive, or if you might be elderly, or if you have renal impairment, again, that might be something where you have a gradual titration upwards according to your response with the medication. Again, that's something that your medical team or your GP would have looked at. So there's high level of evidence that supports low dose or slow release oral morphine for the opioid naive, and that's 10 to 20 milligrams over a 24-hour period. Now, when it comes to trying to become relaxed with your breathlessness, there are some sedative drugs which can help more with the anxiety or panic, or if you're feeling quite agitated with your breathing. So you may well have heard of lorazepam. So lorazepam has a place, 0.5 to 1 milligram sublingual. That's under the tongue. That can give you rapid relief during kind of panic attacks if you've got more anxiety-based breathlessness. Diazepam, oral diazepam, can be used for kind of longer-term management. So that might be midazolam, 2.5 milligrams subcutaneous, or 5 to 10 milligrams in a syringe driver over a 24-hour period. So the above medication with the benzodiazepines are actually quite sedative, so therefore you should be monitored really quite carefully when you're having those medications. We don't want you to be obviously too drowsy with those medications. However, in the terminal stages of your illness, the benefits might usually outweigh those risks. Now, oxygen is something that many people with breathlessness will use. Again, it's something that we still need to be careful about its use because it is a prescribed medication, and it's suitable for people who might be breathless, but you might find that they need just a little bit of a top up with their oxygen to actually help them fall into kind of normal saturation levels. So that will be when they stick the finger probe on your finger just to check where your normal levels are. And again, depending on the type of condition you might have, some people can actually function at quite low saturation levels, so that's the amount of oxygen that's within the blood. Some people can kind of tolerate quite high levels. A really important thing to remember is that your saturation levels don't always correlate to the perception of breathlessness. So you could be saturating or have really high oxygen levels within the bloodstream, but you might still feel breathless. So that's really, really important, because sometimes we can jump to the oxygen straight away, and sometimes it might be that we don't need the oxygen. We actually just need to learn to calm ourselves in other ways with some of the techniques we've described in the videos. Now, oxygen therapy is useful, so making sure that if you're prescribed oxygen that you use it as prescribed, and making sure that you use it appropriately, whether you're using nasal cannulae or whether you're using a face mask, and making sure that you use that as and when it's appropriate to do so. You can also use a fan in conjunction with your oxygen therapy as well. Again, we've got another video where we've talked about that. Steroids have another important role to play. They can help to reduce some of the inflammation in the airways, and that just then helps us to be able to breathe more easily. Bronchodilator drugs, so they're your inhalers or nebulizers. So they're really important because they help to widen the air passages and increase the airflow within our lungs. So again, just makes it easier to get a breath in, and it might help with the exchange of oxygen and carbon dioxide. Diuretics, they can help to get rid of any excess fluid within the lungs which might be causing breathlessness. Antibiotics, again, if you're having multiple sort of infections, say if you had COPD, for instance, they can lead to worsening breathlessness and shortness of breath symptoms, such as kind of bronchitis or pneumonia. So again, you might find that you might have some antibiotics if you get a bit of a chest infection. So again, it's important that we, if we're struggling with our breathing, that we must go and see our GP if we've got any concerns. Saline nebulizers can help to aid mucus clearance and shortness of breath through the humidification of that nebulizer throughout the airways. Again, the nebulizers that you're given, is making sure you stick to the regime that your medical practitioner or GP has prescribed for you. Blood transfusions, again, can sometimes be helpful, and again, they would look at what your hemoglobin levels were before you were given a blood transfusion. But again, that might be something that if your HB levels were low enough, you may well be prescribed a blood transfusion, and that might just help to increase your hemoglobin levels. The hemoglobin is that important compound in the lungs where your oxygen binds to it, so it helps you to carry that oxygen around the body so you can freely use it as energy. And that will help then with your work of breathing, help to try and relax everything down again, and it will help with oxygen delivery, as I said. So lots of different medications there, and again, it's important that you speak to your GP or a medical practitioner, and they will advise on the appropriate medications to help you manage your breathlessness. So we need to think about the role of exercise and how physical activity affects our breathlessness as well. So we know that a lack of physical activity is a major contributor to the progression of breathlessness. So it's really, really important that we don't enter a downward spiral where we've maybe completed moderate exercise, we've got ourselves breathless, and then we end up avoiding that activity entirely. And if we do that, that will lead to muscular and aerobic deconditioning. And then we find that when we go to do even mild exercise, this will lead us to get even more breathless more easily. So it's really, really important that we don't actually avoid those exercises that we're currently able to do, because that will actually make us decondition further. And then if we do that, we might stop even doing those daily activities that we enjoy, the hobbies, and the things that really make our lives important. So the good thing is, even those small changes to your activity levels can actually help you to improve your breathing. So trying to just make those little changes day to day, trying to do a little bit more if you can, that can actually help you to be as fit as possible. So we know that a gradual increase in activity means that your muscles will become stronger and you will feel more confident in your ability to then actually control your breathlessness while doing those activities. So for example, again, think about your day-to-day routine, and you might find that there's certain things that you're fearful about doing because you know that it'll make you get breathless, so you avoid it. But try to think about, your own personal experience day to day. It might be, for example, that you go to make a hot drink, or while you're getting yourself dressed, or you walk into the local shop, or even going out with friends and family, speaking on the phone. That might even make you feel breathless. But what we can do, one of the things we advise people to do here is try and break down that activity. If you break it down into smaller chunks, sometimes it can feel a little bit more manageable. So we do that by thinking about pacing. So pacing is about setting smaller goals that you might be able to achieve more easily, and that might allow you to have a more active lifestyle. For example, it might be that you start practicing sitting to standing from your armchair. It might be that you're walking from room to room. It might be that you start to do little laps around your garden. So again, do what works for you. And again, that might allow you to just move that little bit more and allow you to combat that breathlessness. Now, another thing to just be aware of is while you're doing some of these activities, it's okay to feel moderately breathless. So what we mean by that is that the activity feels comfortable for you, and it might be that you're still able to talk in full sentences, and you might feel that you could continue to do that activity for a little while longer. So that's kind of the sweet spot that we're aiming for, and that will allow you to then improve your muscular and aerobic conditioning. So there are many different types of exercise that you can do. As with any exercise program, it's right to find the right level of exercise that you're able to manage. So make sure that you're not doing anything which is pushing your body too far, making your breathlessness excessively worse, or causing you pain in any way. But to make things a little bit easier, we've set out some chair-based exercises that you will have received in your pack. So take the time to look through those exercises, try and work through them. If you are having any problems with them, you can speak to a member of the rehabilitation team, and they will be able to help you to advise you to do those exercises confidently, so you're making sure you're getting the best out of your body. And just remember that with all of these exercises, it's okay to get moderately breathless. So again, you can check by making sure you can still speak in full sentences, and again, that gives you a good level to aim for. So now I want to talk about stroking the lung meridian. So this is something you may well not have heard of before, but it's an important technique that we can use, and it's another tool that we can have in our toolbox to help manage breathlessness. So the lung meridian is the master of respiration. So it's a common acupuncture point that we can use for illnesses of the lung, the respiratory system, and the heart. It has 11 points that begin in the third intercostal space, and this lung meridian runs down the inside of the arm to the end point, which is the thumb, on the exterior of the thumb. So just by gently stroking down the lung meridian on either side of the body, so again, it could be your right side or your left side, can be a really useful technique to have if we're having an episode of breathlessness. So just by following the images here below, so this is something that you can do yourself, so you can actually stroke your own lung meridian all the way down the arm. If you're feeling really breathless, you might find that it's useful for potentially a carer or a family member or friend who's happy to do it. They might be able to help with this stroking of the lung meridian as well. So we want you to try and sit comfortably in a chair, support your arm on a pillow, and just by using either your own arm or somebody else's palm of the hand, you want to firmly stroke down the arm and keep going all the way down so you kind of run off the thumb. And it's okay to run off the thumb and just give it a bit of a squeeze, as you come off. Additionally, what somebody can do is just do a very, very gentle stroking across the upper back, and that again can help to reduce anxiety. So again, it's another thing you can play around with. You might find that it helps manage your breathlessness, it might not, but maybe give it a try. If you're feeling breathless again, just try and follow the pictures that you can see there. So the active cycle of breathing technique is a set of breathing exercises which is used to relax and open up your airways. These breathing techniques and exercises make your cough work better and help clear mucus out of your lungs. Now, this might be taught to you by a physiotherapist, and again, it's another tool you can use to help mobilize secretions and help you breathe more efficiently. Now, we start with breathing control. Now, this is where the process begins, and then we move through to deep breathing, then we go back to breathing control, and then we end with some of these huffing techniques, which is either a small or one of the bigger huffs. And again, I'll explain how they work in a moment. So just to start with breathing control, I want you to find a comfortable position. And again, you can either breathe in through your nose or in through your mouth, whichever feels most comfortable for you. You want to try and keep your upper chest and your shoulders relaxed. And then I'm going to get you to place your hand just on your tummy. So again, placing your hand onto your stomach, okay? And then I want you to try and feel the rise and the fall of your chest as you start to breathe in. So as you take a nice breath in and a breath out, you'll feel your belly rise and fall. So this is a controlled and gentle breathing exercise to begin with. It just gets you into a relaxed state, relaxes the airways and brings more air into the lungs. Once you've completed the breathing control, you then move towards the deep breathing. The deep breaths are sometimes called thoracic expansion exercises, and they start with your diaphragm by taking a really big deep breath in, and you're filling the upper part of your chest and you're expanding your ribs. So that would look like this. So you can see that my chest is inflated, and then I've relaxed down again. And you want to try and hold that deep breath for about 3 to 4 seconds and then let the air out gently. So this breath helps you to move mucus to the upper part of your lungs and open up the smaller airways of your lungs as well. So again, we're just mobilizing that air around the lungs, trying to get everything kind of moving in the right direction. Then we go back to the breathing control as we first discussed, and you want to spend some time doing the breathing control, again, just trying to relax and just get the air moving into your lungs more efficiently again. Once you've managed to do that, you're then going to move towards the huffing exercises. So the huffing exercise is the part of the technique where you're actually mobilizing secretions. So you're moving them from the outer aspects of your lungs, the peripheries of the lungs, into the central part of your chest. And then hopefully you can then cough them up or huff them up. And that's, again, just a way of clearing your chest. So we'll start with the smaller long huff, and then we've got the big and then short huff. So I'll explain what them two mean. So for the first part, so it's the small long huff. So you're only actually taking a very small breath in through an open mouth and throat. So it's a small breath in, and then you're doing a nice long exhale. So it's a nice long huff out. So small breath in, and so you want that exhale to be pushed until all of the air is expelled out of your lungs. So it can be quite long. And then once you've done that, you can then move towards the slightly bigger deep breath in. So it's a big deep breath in. So it's and then a very short, sharp huff. Now, just remember, one of the key things that people get wrong is when they huff, they actually blow. So you shouldn't be blowing when you do this technique. So you shouldn't be going. So if you're struggling with the technique, one of the little top tips is to grab yourself a little handheld mirror or get close to a mirror, and you should be able to kind of make a bit of mist on the mirror, and that's how you know you've got a nice open mouth and throat and that you're doing the huffing technique properly. So once you've done that technique, hopefully you may well have cleared some secretions. Don't worry if you've not. You might find that you've just opened up your airways a little bit more, but you can continue to do this technique, and just hopefully you'll find that you'll start to clear some secretions. You might also find that you just feel a little bit more open after you've done those exercises. So just repeat that cycle, and you can end with a cough if that helps you to really kind of forcefully clear those last secretions from your lungs. Now, currently during the coronavirus pandemic, it's important that you don't do the active cycle breathing technique in a public space, or if you're in the hospice, because we don't want you to kind of spread any potential infection around. So just make sure that it's okay to do it. If you're at home doing this technique, that should be fine, but just making sure if you've got visitors coming in, that again, you need to make sure that you're not potentially giving them any kind of airborne particles that you might be coughing up as well. So I hope that's been a really useful advice for you, and you take care. Thank you.